what we could do, look at the adductors. Yeah. Now, the adductors are a horrible place to treat because they're painful. Yeah. And the groin pain can be part of it and so on, and even with a hip dysfunction. Bend the knee if you would. Right, so what we do with this, and I've sort of modified, I don't know if you can see properly from the camera point of view, but basically the adductor belly, although people may report pain further down in the groin, is normally shortened, and a lot of people, if they're doing, for example, external rotation for squats, yeah, they're starting to develop a big imbalance between the external and internal hip rotators. So, and the adductors and gracilis, which is right down here. So what we do to make it slightly more tolerable, it is a little uncomfortable, but it goes quickly. Yeah, is you put your foot on your heel to start with, which actually kind of destabilizes the hip a bit and actually puts the treatment, instead of just being in one line, which I'm going to do what I'd call cross-fiber soft tissue or fixing onto the muscle belly. The way we locate that is if you come back out and just slightly out this way, yeah, into abduction, and then you actually push slightly against me going in towards the opposite direction. So we find a bite point, yeah? Now, with the foot, having got that sort of instability, you're sort of getting a three-dimensional aspect to the way you're releasing that muscle, okay? So what happens, what we call, well, the best muscle activation is what's called multiplanar. Yeah, it works in all planes, easily in all directions. Now, when you see footballers practicing all their warm-ups, yeah, you often see them skipping sideways and doing all sorts of stuff to try and break that down and to give them all sorts of weird options to the muscle. So this is doing that as well. It's very three-dimensional. Putting the foot onto the heel, and then, as I said, you're actually going to oddly, I'm going to fix here, but you're going to stir the foot, like you're stirring the porridge, yeah, into a circle. Yeah. Now we're going to go in both directions because you're going to compare which is the easier one, and you're going to find one is quite a lot harder than the other. Yeah. Tight. That's hard. Yeah, yeah. So we work with the harder one. So we work with the most difficult circle. I fix onto the gracilis and to the adductor magnus.
How uncomfortable is that?
Out of 10?
That I'd say is about 6.
Okay.
Pulling this way is
and
a lot more.
You're abducting slightly that direction. So if you pull slightly that, yeah, so there's a little bit of him adducting. I'm slightly putting the pressure on, but very little, just focusing it, and you're doing those circumductions, okay? Yeah. Now, the interesting point about asking how much, and that's exactly how I score it, is that we work on your score out of 10, not mine, because I can't feel it, but I can feel the tension, and you give me the score that you're going to score it, which is 6. Yeah. Yeah. So what we then know is when we go down from 6 to 5 to 4 to 3 to 2 to 1, that we're getting a change. We're getting a release of that muscle. So functional active release. And I can feel it as well. Yeah. So what's interesting is I know where your score is. I can tell you your score now. It's 2.
The circle becomes a lot easier.
The circle becomes easier, yeah. Sorry. So the way, no, you're absolutely right, and thank you. So what's interesting here, and we haven't done this at all before, in fact, today. So what's interesting is that circumduction. So if you think again about gait and rolling gait and how people are running and moving, yeah, that whole circumduction movement, if you can watch that, is actually spreading from the ankle, almost like a pumping action through into the knee. And actually, we could even use the hip in that as well, to start stirring it even slightly in a bigger movement. So you're actually starting to engage even more muscles as you do that. Now that could be also a remedial homework. It looks like not a lot of work, but actually if you get it quite intense and get that dorsiflexion up, it becomes harder. Yeah. So if you start stirring that around, keeping quite a tight, what we're going to say dorsiflexion, but quite a tight circle upwards with the foot. Yeah. Yeah, and that starts to engage the calf more, because I can see it and feel it.
Holding the knee steady.
Holding the knee, and allowing the knee to roll with the foot and ankle movement, yeah? So you're starting to move a lot of muscle groups together, and you can try the opposite way, yeah, which is difficult.
I'm trying to figure that out.
Yeah, no, it is. Yeah. But what you'll then find is that if we then went through some other tests, which we're not going to do today, but if we did, you'd start to feel that the whole leg movement becomes freer and it's easier to engage the muscles, and the fatigue rate would drop as well.